Researchers are out with a new study that experts say is clinically significant. Apparently, patients under the care of female doctors are less likely to die. And this was a substantial study involving 800,000 Medicare patients. Joining me now with more is a top female surgeon in Tampa Bay who dedicates her life to mentoring and advocating for other women to choose careers in medicine, specifically becoming surgeons like her. Dr. Sharona Ross, welcome to Bloom. It is always such an honor to have you on our show.
Thank you. Same here. Same here.
So we have been doing stories about the power of women in medicine for many, many years together. And I thought you were the first person I thought about when this study came out, because you've always been a big believer of our role in medicine.
I think absolutely, and I'm always trying to encourage the younger generation to choose a career in surgery because it's so rewarding and it comes so natural to us women. I mean, we care. We are humble. We are compassionate. We are really wanting always to help and listen to the patient. I think a lot of the care we provide patients, just letting them talk and explain that. You think about the different disorders and diseases that they experience. Who knows better about what they feel other than them living with this? Or treatments that we offer, they know their body the best. And so in other words, women have this tendency to really listen to the patient and then offer all the knowledge that they've learned and experience that they bring to the table. And therefore, patients, on the other hand, enjoy this and overall doing better. I mean, how would we know that patients are doing good or not so great at home unless we listen to how they feel? How are they doing after an operation, you know? And so I think that patients do better under the care of women surgeons and women in physicians is because we listen, because we kind of converse more. We spend more time with the patients. I think that's important to me. And you know, you come to my clinic, patients always say they wait a little bit longer. Wait a little bit longer because we're ready to see everybody who needs to be seen. And patients, I'm proud of my team that well, with us, if you come to see us, within a week or two, you get to be seen. You may wait a little bit, but you will get to be seen and get the care that you deserve.
And you know, this is, I can't stress how much this woman works with other women. I mean, you go all over the country. You bring women here to the Tampa Bay area and you show them firsthand the incredible opportunities that they can have before them if they choose a career, especially as a surgeon like yourself. And I always like to share the story of how the two of us met. My father was diagnosed with pancreatic cancer. My brother and I just started deep diving into, you know, what would be the best way to remove the tumor, and we found the leading robotic surgeon in the nation, one of the top right here, and that would be you. And then, you know, after my father passed, you took incredible care of him. You got the tumor out successfully. He lived a little bit longer. It was the best results possible, but I never knew that that would bring us together in the way that it did as friends, you know, sharing medical stories together in the community. And you really taught me throughout the years really the potential for women out there that want to choose this career.
Absolutely, it was always an honor and a privilege to take care of your dad. Women, especially in a surgical field, it's male-dominated, right? And so us women, as a minority, still have to help each other. We have to mentor. It's hard for a woman, you know, from the younger generation to find a mentor if there are not a lot of women surgeons. Now, we've come a long way. So we have more women in leadership position, like chairs in academic programs, presidents in surgical societies. But what we need now is women to elevate other women. And it starts with one person, but then it spreads all around the country. And this past year, when we had the symposium, the Women's Surgery Career Symposium here in Tampa, we brought women from like all different countries, not just the US, but we had from Kenya, Ethiopia, from Turkey, from the Netherlands, from Spain, Italy. I mean, it goes on and on the list. It was unbelievable. From Korea, China, Japan, India. We had strong women surgeons who have a lot of like challenges in their countries, and we all came together to help one another. And the thought for next year is to develop those chapters in all the different countries and stream it from here, Tampa Bay, right, to all around the world for women surgeons. So we unite like a village, like a village that all women, younger generation and older generation, can help each other, can network, can elevate one another, because together we are the strongest. We are a force.
It's true.
But unless we help each other, it's not going to happen. So we have more women that are coming up, more leaders that are wonderful women, but now we have to elevate the rest. And if it was difficult for me and really challenging for me and the generations before me, we should make it easier for the younger generation, because they're going to have a whole different set of challenges. So let's help elevate them. One small short story that I wanted to share with you. 2 days ago, I was in the operating room, and usually I have a team of women around the patients while I'm on the console operating. And 4 guys, with 2 students that learning how to scrub tech and then first assist. 4 guys around the patient, and I asked, so we finished the robotic whipple, and we just putting glue, like applied this gel over the anastomosis. So one of them is doing that, and I'm directing it, right, on the console. And I asked one of the other guys to just irrigate and suck, right? And it's amazing how when I asked to irrigate and suck, suddenly the TCL injection is stopped. It's like they suddenly work like one brain. One unit, one group, you know, that is united. It's like innate in guys to. And then when I asked, okay, let's continue with the injection here, and the suction stopped, and the glue is going on. And I was like, when I'm used to working with women, they all independently work. They focus on what they're doing. They're very multitaskers, but they don't necessarily work as
a team.
One team.
And that's what we got to work towards.
It's not innate. We're more like that. We're coming a long way now.
We're
getting better.
And with you at the helm, we are going to get there. And I'm going to share Dr. Ross's story, and I'm also going to put some information about a big women's summit coming up through Advent on bloomtampabay.com. We'll tell you all about it. She's behind that as well.